The United States is loosening some restrictions for fully vaccinated people, while countries like Brazil and India are fighting to contain a third wave that is surging out of control. Hello, I'm Anand Naidu, and this is The Heat. With more than half of the adult population in the United States having received at least one dose of the vaccine, the government is loosening some restrictions, allowing fully vaccinated people to go without masks outdoors and in restaurants or small gatherings. The average number of new daily cases in the U.S. dropped to under 50,000, but in other parts of the world we have a completely different picture.
More cases of COVID-19 have been reported globally in the past 2 weeks than during the first 6 months of the pandemic. India and Brazil account for more than half of last week's cases.
Brazil reported more than 407,000 deaths since the beginning of the pandemic. It's the country with most deaths after the United States. We will talk about Brazil later, but first, India. The health system in that country is overwhelmed as the country registers close to 20 million cases. And there are fears that the official figure is severely underreported. Earlier, I spoke with journalist Asad Ashraf, who just lost his father to COVID. His mother is also being treated for it. I started by asking him about the situation there.
So, yeah, this has been a very difficult time for us here in India, and personally for me, I have been engaged with my family for the past 10 days dealing with their health crisis, and unfortunately 2 days ago I lost my father in this battle against COVID. And this was more than the virus. This was the system and the misgovernance which is there in the country right now. I would hold that responsible for this death of my father. We didn't get proper health care the moment we needed it. We didn't get adequate medical facilities the moment we needed it. We kept on banging here and there for oxygen cylinders. We didn't get it in time. We kept on dialing phone numbers at hospitals. No one picked up. We finally took him to a government hospital, and the condition of the government hospital was such that no one came to visit him in 24 hours, and he unfortunately passed away. And this is happening with someone who's this is happening with someone who's still a journalist and has some influence among the fraternity, among some circles in the city. But I wonder what would be happening with the commoner right now, and I wonder what would be happening with the people who do not have any influence, who do not have any resources, who do not have anything by their side. What would be happening by them? What would be happening to them? So it's a very, very terrible situation in India right now. And personally, for me, it's a big loss. For my family, it's a big loss. We've already lost my father, and my mother is still undergoing treatment inside an ICU care. So yeah, this is what has happened. This is what is happening with the family right now.
That's right. We've seen these heartbreaking pictures of people at hospitals pleading for beds, see others pleading for oxygen, people using social media to try and get help. You did that yourself. What is the situation right now?
The situation right now is that all hospitals are crowded. We do not have beds in the capital city. Forget about small cities and tier 2 and tier 3 cities. All hospitals in Delhi are running out of oxygen cylinders. All hospitals are complaining in Delhi that they're not getting adequate oxygen supply. I personally get calls from friends and acquaintances every day asking me to get them help in getting an oxygen cylinder. So I think the condition is terrible in India right now, and the condition is such that we do not know where to head if someone falls ill. We just do not know where to head because there is no doctor available, there is no hospital available, there are no beds available in the hospital, there are no oxygen cylinders available, even though the government is claiming that there are adequate oxygen supply. But then what I have seen from my experience and what people have been telling me and what we have been seeing on social media is that there is total deficit of oxygen supply in India right now. and it's a huge, huge crisis in the country, which is leading to n number of deaths. I mean, the figures that are coming out through government sources, I don't think they're right. They're the correct figures. It would be much more than that. So it's a very, very challenging and difficult time for everyone living in India, and we hope and pray that we come out of it very soon.
Yes, that issue that you mentioned of numbers, very serious questions are being raised about that. Health officials reported one number, which was very high. It was 400,000 infections in just one day. However, there has been a study done. That study was done by a university here in the United States, which indicates that India is only reporting 3 to 4% of cases. Now, if that is the case, that means that infections, the real number, could be as high as 10 million. I mean, what are you seeing in a big city like New Delhi?
So when you say that infection is going to be as high as 10 million, it's almost the entire population of the country, little less than that. So yeah, I mean, people who are asymptomatic are not getting tested, and testing facilities are very minimal. RT-PCR test, which is the basic test available for detecting COVID, is not available in cities like Delhi, is not available in a city like Patna. I had to wait for it for 3 days for my father to get tested for COVID, and I had to actually call up people, dial up people, reach out to people for help to get my father tested for COVID. So you can understand the situation and the numbers that the numbers that would be the real numbers of people who are COVID positive right now, because getting tested is a challenge. And when you go to rural India, I think that there is absolutely no testing facility, because I have some relatives in rural India. I know some people in rural India, and rural India, when someone falls ill, they generally go to a quack, and the quack diagnoses something else, and eventually these people die. So I think the condition is extremely, extremely pathetic in India right now. The numbers are much, much, much higher than what is being told to us, what is being briefed to us every day. So as you said that, it's 10 times, it would be 10 times higher than what is being projected. I do not have doubts in that. And I think that it would be somewhere close to that.
Now, what kind of mitigation measures are being implemented? I mean, if you take someone like yourself, what kind of precautions can you take? What about the availability of things like masks? Are people complying with social distancing restrictions, for instance?
People have been last year when the pandemic broke out, and when the government was very vigilant, and when the government gave out instructions of following social distancing norms, of wearing a mask. Of course, people did do that. People complied to whatever the government whatever the government advised. But then, unfortunately, in the middle of all this, this government which we have in India right now, under the leadership of Prime Minister Narendra Modi, declared a premature victory over COVID. And with that declaration of premature victory over COVID, the common people thought the COVID is gone and there is no threat of COVID in this country anymore. And then we had elections in different states, where huge numbers of people gathered at one place and rallies were being addressed. Common people saw all these images on television sets. Some of them went to rallies, and they thought that everything is fine around them, which in turn led to this crisis where we are right now. So common people follow their leaders here, and unfortunately leaders have not been very vigilant. You can see Prime Minister Narendra Modi, you can see different leaders from the ruling party going to campaigns without wearing a mask. He should be sending a strong message by wearing a mask himself, which is not the case.
That's right.
He has addressed several rallies. He has addressed several rallies in West Bengal elections where he is not wearing a mask. So people follow their leaders, and unfortunately leaders have not been vigilant themselves. Unfortunately, leaders gave them a false hope that the COVID is gone from India, and India has already achieved victory over COVID, which was far away from reality.
That's right. You know, the pandemic has become very politicized in India, as it has in other countries as well. And it's not just an issue of misgovernance. I mean, as you've just pointed out, there have been actions that have been taken that have actually made the crisis even worse. There are reports of laboratories being pressured to manipulate numbers to make it look like there are fewer people who have been infected. As you pointed out, there have been these huge political rallies that have gone ahead as well. The government even approved a religious festival where there were hundreds of thousands of people, most of them without any kind of precautions whatsoever. I mean, to what extent has all of this contributed to these runaway numbers that we see?
Absolutely. I mean, this festival going on right now at Kumbh is a major worry for everyone who is concerned about this virus in India. And the government has given let it happen, where lakhs and lakhs of people have gathered together to take holy dips. So you can imagine, when the infection is so contagious and so many people are already out there infected, what would happen if lakhs and lakhs, millions of people would gather at one place for a month, and they would carry out the religious event. So I think the government has been pretty negligent on that part too. And apart from that, yes, you are right that there are manipulation. As far as I also understand, and as far as I also think there are manipulation in testing labs, and there are manipulation at hospitals too, whereby when a person dies of COVID, is declared dead because of diabetes or a heart attack. So that has been reported from all over India. So all these things have contributed. I mean, if the government would have been honest in giving a fair estimate of what's happening right now, I think things would have been in a much better place, and there would have actually been the right thinking in a direction that could have saved us from the crisis. But what we see right now is that the government is trying to put a curtain to the reality that we are in, and it's trying to hide something, which is not a good approach to fight a pandemic like this. It has to be at least honest with what's happening in the country before going ahead and solving the crisis.
What about the vaccination rollout in India? I mean, India is actually a manufacturer of these vaccines, but up to now, there's only 2% of its population that have been vaccinated.
Yeah, because the focus was on exporting vaccines, and they did the entire focus initially was on exporting vaccines, which they have put some restrictions on right now. So, but the fact is that a lot of raw materials which are necessary to produce these vaccines have already been used in making vaccines which have been exported from India. So that is one reason why the percentage of vaccination is low. Other than that, there has been no awareness drive carried out by the government to get people vaccinated. People in big cities know that still are more aware about the fact that they need to get vaccinated. But if you go to hinterlands of India and rural India, no one knows that there is no one even knows that there is a vaccine yet. So and India is majorly rural. So that is one reason why there is a very low percentage of vaccination done in India right now. And apart from that, what I think is also the fact that people are not ready to trust these vaccines. There is a problem there and for which government cannot be blamed. I mean, there is a problem with the mentality of the people and the psyche of the people, because they've heard some cases where people have had side effects of vaccines, and this fear makes them not to go for getting vaccinated at all. So this is something problematic, and this can only be solved through proper awareness. So we do not have mass awareness drive, mass campaigns that would create such awareness right now. So these are the reason why we have a very low percentage of vaccination in India as of now.
Asad Ashraf, thanks so much for joining us, and our condolences again to you and your family.
Thank you so much. Thank you so much.
To continue our conversation on the COVID pandemic, let's bring in our panel. From Sao Paulo via Skype, Jose Roberto de Toledo is an editor-at-large for Piaui Magazine. From New York, also via Skype, Dr. Lipi Roy is Medical Director of COVID Isolation and Quarantine Sites at Housing Works. And Dr. Gary Morsch is the President and founder of COVID Care Force. He joins us from Bucyrus in Kansas. Welcome to all of you. Jose Roberto, let me start with you. Brazil's COVID experience is not unlike that of India's, and we did mention that very alarming figure at the beginning of the program. 400,000 people, a little over 400,000 people have died in Brazil from this virus. What is your assessment of the situation in the country right now?
Well, let's beginning to say that we have just less than 3% of the world population, and we had already 13% of the deaths. So we have almost 5 times the amount of death that we should have. And many other problems. Mainly, the government has done a terrible job. The president is gathering with lots of people without masks all the time, and he is promoting drugs that are ineffective, like hydroxychloroquine. He didn't buy vaccines when he could in August and September, when he had offers from Pfizer and other labs. And he is confronting the governors and mayors who try to promote lockdown in their states.
And what is the situation, Jose Roberto, insofar as compliance by people with social distancing, with wearing masks, with taking precautions?
Most people do it, but most people can't stay at home. They have to get out to work, and public transportation is full of people. Even if you wear masks, it doesn't do a great job preventing the virus to expand and to get to other people. And I think that we didn't have an effective lockdown at any time. We had twice lockdowns, but that were not exactly lockdowns. It was kind of Brazilian lockdowns. So part of the people stayed at home, part of the people went to the streets, and so people are now getting a little bit confused if these measures are really effective, because we had already the second wave and probably are going to have a third one.
Gary Morsch, looking at the global picture here, despite the improved situation in the United States and in other parts of the world, I mean, what we heard a moment ago from the head of the WHO, the World Health Organization, must be of deep concern. And just to recap what Dr. Tedros Ghebreyesus had to say, he said that in the past 2 weeks, there have been more COVID cases than in the first 6 months of the pandemic. What are we to make of that? Because, there is a view that's been going around, I don't know whether it's a conventional view, but there is a view that the worst is over, that we're emerging from this crisis right now.
Well, I wish I could say that the worst was over, but I'm not sure that's the case, and it's certainly not the case in Brazil. It's not the case in India, and there'll probably be other countries that where the resurgence just overwhelms these nations. So it's a very serious, probably the most serious place we've been globally. Fortunately, there are countries that are getting beyond this and dealing with it well, and so there is some good news as well, in spite of the bad news.
And what do you make so far of the vaccine rollout? We've seen a pretty successful vaccine rollout in the last few months in the United States, similarly in some of the countries of Europe. But what about the rest of the world?
Well, Brazil has they've got they're not keeping up. I was in contact with public health officials in the Philippines. Only about 2 to 3% of their population has been vaccinated, and they're struggling to get the vaccine rolled out. India, of course, we know what's going on there. So there are countries where the vaccine rollout is just is dismal, and the virus, this coronavirus, is going to wreak havoc while they try to catch up with the vaccine. Fortunately, in the United States, we've done a good job on the vaccine rollout, although there's so many people that are still resistant to it. But we have done a good job, I believe.
Lipi Roy, great to have you with us on the show. You are in New York City, and at one time, New York was, of course, the epicenter of this pandemic, if you remember those first few months when the pandemic swept the world. But now there are plans to reopen not just New York City, but we heard of plans on Monday afternoon from 3 states, the so-called tri-state areas, Connecticut, New Jersey, and New York, to open most businesses by the middle of May. That's only next week. And the New York mayor, in fact, has been talking about opening businesses, theaters, offices, open at full strength. Is that a good idea, do you think?
Well, yeah, first of all, it's so great to be here with you. Thank you so much. And yeah, you're absolutely right. Exactly 1 year and 1 month ago, New York was the epicenter of this global infectious disease outbreak. New York had the most cases, hospitalizations, and deaths from coronavirus or COVID-19. And it's quite astonishing to see that a year later, we are thankfully where we are, which is a low number of cases, the lowest in the past 6 months, coinciding with a rise in vaccination rates. 1/3 of New Yorkers are fully vaccinated, about half at least have 1 dose. But when I think of India, where many of my relatives still live and are deeply affected, I'm so deeply concerned. All the mitigation measures that New Yorkers did a year ago, that's what needs to happen in India. Universal masking, stay-at-home orders. Prime Minister Modi and his government really needs to implement these tried and true, evidence-based, effective public health measures and get the vaccine out, as well as medications and supplies and oxygen. It's the only way to reduce and relieve the burden on the healthcare workers, the frontline doctors and nurses, because they're going to be facing a tremendous toll psychologically and mentally, just like our doctors and nurses and other frontline healthcare workers did here, not only in New York, but the rest of the country.
All right, and Lipi, looking at the situation in a place like New York, I mean, was there some kind of threshold or benchmark that the city or the state looked at when they made this decision to reopen? And what is that? What kind of percentage are you looking at of people being vaccinated or rates of infection going down? What is that point when you can make that decision?
Yeah, that's a great question. And the reason why that's important is that the decisions that our local and state elected officials are making are based on data. The key metrics or clinical outcomes or measures that they're looking at are total number of cases, hospitalizations, as well as test positivity rate. The latter 2 numbers have been going down really nicely. I mean, we still are averaging about 2,000 to 3,000 new infections a day, but compared to a year ago or last April 2020, we had about 12,000 cases and about 1,000 deaths. Whereas now I think about 30, 40, 50 deaths per day. But the test positivity rate is at about 1.49%. Again, that's the number you want, less than 3%. And again, that's at 1.49. That's the lowest we've seen in the last 6 months.
Jose Roberto, what is the vaccination situation in Brazil? We heard again today on Monday that the government had put in an order for 100 million doses of the vaccine. We don't know when that's going to be delivered, but I mean, how would that help? What is the rollout like, and is it effective?
No. Almost 15% of the population had been vaccinated so far, and but there's no enough doses to vaccinate everybody. Brazil has a track record of vaccinating lots of people for flu, for instance, to 2 million people a day. But we could do that again against coronavirus, but we don't have enough doses. So the daily average is below 1 million, and for 200,000, 12 million people, it will get 300 days to get all the population above 18 years old to get vaccinated. So unfortunately, the prognosis is that we are going to be suffering from this for at least 6 to 8 months until all the people who must be vaccinated get their doses.
Gary, there was a report on the front page of the New York Times on Monday morning, which had a lot of people talking, and that report basically said, quoting experts in the United States, saying that the country will not be able to reach herd immunity because of that very high number of people who say that they will not be taking the vaccine. I mean, how concerned should one be about this? I mean, could it cause another wave if we have up to 1/3 of eligible people not taking the vaccine?
Right. I mean, it is frightening that this article from the New York Times, and it's really a consensus, I think, among scientists and medical experts that it's likely that we're not going to reach herd immunity in the United States. There are communities that have. I work a lot with the Navajo Nation and other Indian tribes, and they've done a good job, and some of them have reached herd immunity. But in the United States, it looks like that may not happen. And then while that's not happening, you're going to have more variants rise, and that's what's really concerning as well. So we may be in for some difficult times here in the United States, in spite of our success at getting up to 60% of our adults already vaccinated.
Right, Lipi Roy, what are your thoughts on herd immunity? Because looking at some figures here, 44% of the eligible group in this country have received at least one dose of the vaccine. 31% are fully vaccinated. And now we have this New York Times report. I mean, does that mean it would take a much longer time to get back to some kind of normality, or if we get there at all?
Yeah, I don't see that the word normal is going to have to be redefined.
Yeah.
And I really agree with Gary's point in terms of the variants are the concern, and we're going to continue. Remember, the viruses mutate. That's just what they do. Their goal is to continue to survive and thrive. And unfortunately, we as a human race, different parts of the world are doing better than others, but we're not really behaving the way that we should in the midst of a pandemic. We need to still be practicing strong mitigation measures. Vaccination rates need to continue, but in the meantime, we need to continue masking and distancing until a good 70 to 80% of the population is vaccinated. And yes, it's a significant problem here, vaccine hesitancy, misinformation here in the United States, as it is in many other parts of the world, including India. So we need to really, really address the anti-vaxxer movement, as well as people who just don't know, don't understand the vaccine, they don't understand the technology, they're overblowing the side effects. So we in the public health world, medical world, media, we need to do a really good job, effective, persistent job at educating the public and being transparent about the data about the vaccines, which are the most safest medications out there. I mean, Tylenol, ibuprofen have way more side effects than the average vaccine, which has to go through the strictest of safety measures.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat, but the conversation continues online. Join us on CGTN America's Facebook page to comment on this or any other show, or chat with us on Twitter on CGTN America. I'm Anand Naidu in Washington, D.C. Thanks for watching.